Hi guys, so my name is Desiree, I'm the Volunteer Program Manager, and I'm super excited to talk to you today about the Global Health Intensive Summer Program for 2016. I want to start off by talking a little bit about our founder and our medical director, Dr. Laura Barahon. If you come down this summer, you would be interacting with her a lot. And Dr. Laura has a similar vision as her father-in-law had. Her father-in-law, Dr. Gustavo Barahon, is a Nicaraguan physician who kind of started the whole community health workers model in Nicaragua. And this was about 50 years ago. So we've been working with a community-based model for almost 50 years. And he had a very interesting way of seeing things, and you can kind of see it in this quote. He believed that doctors were more than just doctors. They were also teachers, and that no matter how complex information could be, how difficult medicine could be, you could still figure out a way to simplify things so that everyone, no matter how low their education level was, could understand it. And this way, you could help empower people to improve their health and improve their lives. And so that's what we believe to this day. We believe that no child should die of a preventable illness. And Dr. Laura carries on this vision of Dr. Gustavo Barahon, and you'll be able to see it in everything that we do. One of the you're able to see our mission on the website as well, but it's basically to improve the health of impoverished communities by working alongside them in health education and development. And it seems very simple, but there are some very key words here. The first one being we work alongside communities. We don't just work at or in them. We actually care about what their needs are, what their strengths are, what their assets are, what can they bring to the table, what are their felt problems, and it's taking their opinion into consideration. It takes a lot of time and effort to coordinate that, but it has created more long-term sustainable impact than other interventions where that's not taken into consideration. So this is just an example of one of our interventions, the impact of one of our interventions. One of our main ones is working with maternal and child health. And you'll be able to see here a graph where you see the decrease of deaths in children under 5 from 2012 where we had 10 to 2015 where we had 0. And then for neonatal deaths, these are babies 28 days or younger, from 8 in 2012 to 1 in 2015. This is only statistics from the communities that we work in, so that's about 28 rural communities in Nicaragua. For those of you that like statistics and identify a lot, or that's your way of understanding results. So this is one of the main focuses, and just to give you an example of an intervention, and we wish to have the same success rate in all interventions that we do. So we like to link, of course, all of our interventions and main programs into our volunteer program. But I want to start off by telling you a little bit about the history of the volunteer program. We had several volunteers wanting to come down, several students wanting to come down and learn about AMIS and learn about the model of public health that we have. And it was great. And we understand how popular global health was becoming, and we were really excited to share our model. But it became so that we had so many volunteers that we couldn't give them the time, the dedication to make sure that they were being linked in correctly. It was actually very overwhelming because of the time it took away from staff that already had their own job and their own responsibilities. And we really didn't want to just make up projects to entertain volunteers. That is definitely not the way AMOS works, and it's not our mission as a volunteer program or as an organization. What we wanted to do is basically, and here you can see the volunteer program mission. We wanted to make an impact on the future of global health professionals by training future leaders to understand and critically address the challenges of the community-centered approach. So we understood that volunteers were, studying a lot of, they had the background in public health. They were studying their majors and their masters in public health, and there was this thirst for more knowledge, for more field experience. And this is where the problem with praxis comes up. We understood that they were wanting to have more real-life experience, because we know that no matter how great a teacher is, or how much reading you do, or how much time is spent in a classroom, it's going to look different once you're in the field and in real life. And so there is a need for praxis. And our goal was to make sure that this practice was not something that had no long-term sustainable impact. We didn't want these short-term mission trips for 1 week where you can give yourself a pat on the back for helping someone for a week without knowing of the actual effect that your volunteer work did. And so we basically wanted to answer two very tough questions. And it's, how do you give students the opportunity to learn and practice public health skills while creating real impact without exacerbating the very inequalities you wish to address? And that we answered, or we attempted to answer, because it's very complex, with the Global Health Summer Intensive that is made up of 3 weeks of practicum and 6 weeks of internships. Now, I want to talk a little bit more about the practicum, because I don't want you to to feel that the practicum is all theory and then the internship is the field work. The practicum in itself is very complete. It's a mix of theory and field work. And then the internships just gives you an opportunity to extend the application of skills learned in the field. So talking a little bit about the two questions that we had, we created the Global Health Practicum, and it has 3 main components, which is to critically analyze healthcare models, build relationships, and apply skills in fields. Now, what do these 3 mean? I'm going to start with the first one. What does it mean to critically analyze healthcare models? And we have a quote here that kind of explains what we mean. And it says, to understand another person's reality, we must learn to deconstruct our own. And this is, like I was saying, the first component of the practicum is understanding you. What is your role in the system? What is your role in the status quo? And how are you being perceived coming in? So you are, are you aware of your power and privilege? Because you will have that. How do you deal with that? How do you not abuse of your power and privilege? How are foreigners perceived? And this has to do with how what's happened in their history. How many U.S. interventions has there been? And then talking about the impact of international policies is another aspect that we touch in the practicum. How do policies made by the World Bank or the IMF or or WHO or the new MDGs, how does this influence national policy, and how does what the government, what are the interventions that they decide to implement, how does that look like for someone in the rural communities? How does how do international policies affect and government policies affect how nonprofits work and the type of interventions they receive funding for and that they're required to focus on? How does that look for someone in the rural communities? So it's basically learning how to see the big picture, but also learning how to see yourself in the system, in this big picture. What is your role, and how do you want to work with the people in the rural communities based on all these factors that I just mentioned: international, national policy, resources available, plus all of the cultural factors and just the history and the way that you're perceived in a community. So those are some of the topics that we talk about in the practicum. And we mix those up a little with what we call cultural humility. So we understand the importance of relationship building. And a lot of times these interventions, it's a long process where you have to understand, your surroundings. You have to understand the other person's culture, and not only the country's culture in general, but culture specific to the community that you're working in. What are their, common practices? What is the reason behind these practices? What is their way of working? How have they solved certain problems in the past? Understanding that we are an outsider and that we have so much to learn from them, and taking the time to meet with them, to spend time with them, to create this relationship of trust will complement your planning process for any intervention, in a way that will guarantee a bigger success rate than other interventions that don't take the time. So it does take more time than intervention where you already believe to have the solution to the problem and you just come in and implement it. But the success rate of actually taking the time of doing community-based approach to solve any XY problem in the community will give you a higher success rate. So we talk about that, and we also experience that when we're going to the communities. So building relationships in the field to empower and contribute to real change is basically what we just talked about. And the third component that I'm about to talk about are the skills that you're taught during the practicum, that you can practice in the field during the practicum and also in the field during the internships. To mention a few, you learn skills such as monitoring and evaluation in a real setting. How do you do data collection and analysis? How do you do surveys? How do you develop curriculum for people that have very low literacy rate? What are some empowerment tools and strategies that you can implement in communities? And if you want to get a little bit more technical, depending on the internships, you learn things like what are the different water filtration systems available at the moment that we work with? What are, some basic lab tests, technologies that you can learn how, how do you do basic health assessments that are easy to do in the community? How do you teach basic medical protocols to locals so that they can then duplicate it when Amos is not there? How do you analyze certain or identify certain problems in the community and then reinforce them based on results? So also part of monitoring evaluation. There are so many skills I could actually keep going and talking about them, but I want to give you some examples of some of the skills that the volunteers learned in the past through the internships that we did. And at the same time, we'll be talking about the interventions and internships we'll be doing this year as well. So the first one we did was Women's Empowerment in Health and Nutrition. And we will be having this internship. So basically what the interns did was do basic health assessments for children under 5 and pregnant women. So we tested anemia, weight and height. We tested hemoglobin, we took their weight and height measurements to test for malnutrition and anemia. And we also gave counseling and vitamin supplementation. But we didn't stop there. As part of our community-based model, we have to leave the information with the community. We have to present the results to the community. So one of our interns made this pie chart that seems very simple, I believe, to present results to the health committee. And the health committee is, a group of locals that represent the community, and it's one of the ways the community is organized, and it facilitates ways to communicate with people. So we presented these results with pie charts, and unfortunately, they weren't as simple as we thought, and the health committee members struggled understanding this concept because, first of all, they don't eat pies, and second of all, they never seen data presented in this way. So it didn't have the reaction expected when we met with the health committee. And so they had to be a little bit more creative and present the data by drawing little humans and coloring them in different colors so that they could get an idea of the percentage of malnourished or anemic children by weight and by height, and as well as those that were in risk. And the reaction from the health committee, the response from the health committee was amazing because they were extremely interested in seeing which sector was affected the most, and they were thinking of possible reasons why that was the case. And we worked with them to develop an action plan to improve the level of nutrition of their children. And they requested nutrition training. And so the volunteers, the interns, were extremely excited. We came back to Maternal, worked for a week on preparing the manuals. We previously done research with them to identify what was available in the communities. What are the fruits and vegetables available in the community in order to make the training that the interns were developing relevant, right? And so we went back, and we were extremely excited, and we felt like it was very simple, easy to use as well. And we started the training, and we realized that they weren't understanding a lot of it. It was too much information and too confusing. And we understand that food groups is not an easy concept to remember, and for anyone to remember all the food groups and what they're exactly good for. And so we we basically had to work with what we had and the time we had, and the interns had to develop a whole new, or make changes to the manual and simplify things. And it took time. We had to use the resources that we had available, and we had very little time to implement the training because of the changes made. But finally, the last manual that was developed with the help of the health committee was made, and we were able to see that it was a lot easier to understand. And the volunteers went out to the rural communities, did the home visits to observe how the trained health committee members gave basically the counseling on the food groups and the type of fruits and vegetables available and what they were good for. And it was extremely fulfilling to see the interns working with the health committee and seeing the results of the trained health committee members. And the rural healthcare team continues to use this manual to this day. So we were very excited with those results. To talk to you a little bit about the second internship, I want to talk about the clean water systems intervention. One of the community-based factors to take into consideration is not introducing an intervention to a problem that the community does not consider a problem. So you go into a community and you know that the water is contaminated, and you bring this water filter and you tell the community member, so here's this water filter, you should use it because your water is contaminated. Most likely that their reaction will be, thank you, and I appreciate the gift, and they would maybe even just accept it. But deep down they might not really care because their way of thinking is, well, actually I've been drinking this water for 40 years and I'm doing okay, so I don't think I need your water filter. And that's pretty fair, right? So we need to present proof in a way that they understand it, and a lot of times it depends on the relationship that you already built with this community, right? So what we do in the case of the clean water systems is we go with them to the different water sources, we take samples, we test them with our portable incubator that we take to the communities, and you put the 25 drops of water, the sample of 25 drops, in the incubator for about 24 to 48 hours. And then you see the results in color. So you can see the picture here where you see that there are some darker little dots. The darker ones, or the blue ones, is E. coli, and then the red ones are coliforms. So you basically show these results to them that are quite shocking to anyone who sees them. And you explain, this is the amount of fecal matter in 25 drops of your water from this water source. And you can imagine the reaction from the community members, as well as anyone there present, staff as well. It creates a visual impact that triggers, it basically creates a window to understand that there is a problem and that we need to think of a possible solution. So you wouldn't start by giving them a filter right away. There's a whole process for that. There's a whole educational process to the importance of water, hygiene and sanitation topics, the importance of giving good maintenance, because it's not easy to have one of these water filter technologies that we have. And volunteers help us throughout the process. They help us in the different stages. Sometimes it's to test the water and present the results. Sometimes it's to educate people on hygiene and sanitation topics, like we did this year. Our interns were able to work with what we call the water promoters. This is a pilot project where they are community health workers, but they're focused on hygiene and sanitation. And so these were trained by our interns this past summer, and our plan is to expand to analyze the results of this pilot, and also expand it to other communities. And so volunteers also help us through installation of certain water filters, depending on what stage the community is in. And we love doing monitoring and evaluation because, as you can imagine, you can give them a filter, you can give them a solution to their problem, but you don't know if it was a long-term sustainable solution. So it is necessary to go back and monitor and evaluate. You do surveys, you visit from house to house, you test the water filters. Are they working correctly? Are they giving problems? What are the problems? And most importantly, are they recontaminating the water once it's already filtered? And once you have the answer to all of these questions, it's easier to define what we need to work on. And a lot of times our interns help us with creative solutions to reinforce a lot of the practices that need some reinforcement or re-education. To give you another example, and this is the last intervention and internship that we'll be doing this year. We work with a youth empowerment program. So we also pilot this in the region of La Ras, in one of the communities. And the main purpose of this intervention last year, this pilot, was to test the feasibility of doing youth empowerment, of implementing the youth empowerment program in the region of La Ras, which is the region, it's the South Atlantic region of the country. It's the farthest to get to, the hardest to get to. And the interns were able to assess what were the main topics that they needed or seek training in, that the youth struggled with? What are some life skills that they need to be trained in? What support would they need from AMIS and from their health committee in order to ensure that the youth program does not last only the duration of the summer, right? So with the results and the data from this pilot, we were able to write a grant that just recently got approved. So we have received funding for 3 years to implement this and spread this program to other communities that we work in the same region. And that's what our volunteers are going to help us do for this summer 2016 with the Youth Empowerment Internship. So we're super excited about that. So as you can see, you have to implement the 3 factors or the 3 components that are part of the practicum and also in the internship. You are putting all this theory into practice by building a relationship, by understanding the context that you're in, and by applying the skills that you just acquired. And we understand that it's an iterative process where we are improving every single year, we're making changes, and it's a puzzle. It takes efforts from different areas in order to coordinate and ensure that there will be follow-up and that this is a need in both the community, and it goes along with the mission of AMIS to ensure that the volunteers, the interns, have a fulfilling experience, but also the impact that we want to create in the communities. So of course we love monitoring evaluation, and we wanted to ask students to see if we'd actually given a solution to the question that we made at the beginning of, did we give students the opportunity to learn while creating real impact without exacerbating inequality? And from the survey that we gave them, one of the questions was my work valued and did it contribute to their organization? And the result was 4.79 out of 5. So that was really great to see that they did feel this. And then, of course, we also did evaluation in the communities, because we wanted not only the volunteers' opinion, but also the community. And we got some great feedback. The thing they appreciated the most was the level of accompaniment that the volunteers gave them, being, hours of the day hiking, going from house to house to do home visits, using, either horseback riding, walking, or by boat, to make sure that what they had been trained in had actually, been understood by the health committee members and by the waterpreneurs, and that it was actually being well explained to the families. And we also got some interesting feedback on the amount of time that we should be in the communities. What is too long? What is enough time to actually implement these projects in a way that it doesn't affect the whole routine, the whole life of the community members that are working with us, because we understand that they too have jobs, and we need to be very considerate of that. So that's something that we're taking into consideration for our internships this year, and our amount of time in the communities as well. So basically, we implement public health with cultural humility to help ensure sustainable and long-term impact. And that's why we invite you to the Global Health Practicum. As you can see, it requires a lot of coordination in order to make sure that it is successful in the impact that we're creating and it's sustainable. So that's why you will see that it is not a low cost. It is quite an investment, but we are very sure of that it is a investment worth fundraising for or working towards for, because not only the amount of time put into it by AMIS staff, but also the experience that you will acquire from spending time with us this summer. So you'll see that the practicum has a cost of $2,400, and this includes food, lodging, transportation to the rural communities, airport pickup and drop off, And then all project costs that go with coordination, preceptorship, all the materials in the field, all the project materials, all the practical materials, the guest speakers, all coordination is included in the cost of the $2,400. What is not included is airfare. And then for the internship, it's $2,500 more, and this again includes all food, lodging, and country transportation to the rural communities, airport pickup and drop off, of course, and all project materials, preceptorship as well. For a total of $4,900 for the 9 weeks. And we have volunteers that fundraise, that request financial aid, that do crowd fundraising, that request support from their church. So we encourage you to apply as soon as possible in order to receive a decision from us as soon as possible for you to figure out how you would do how would you be able to raise all of these funds. The different methods, like I mentioned earlier, are some possibilities, and AMA staff helps you along the way if you are very interested in this type of experience. Just to remind you, the practicum starts on June 5th through August 25th, and then the internships extend through August 6th. So internships are from June 5th to starting with the practicum and then ending on August 6th. And the application process, please remember that the application deadline is February 14th, 2016, and it's Valentine's Day, so this was just a funny way to remember that if you love this program, then you better do it before the end of Valentine's Day. And these are the requirements. Please fill out your online application. This is located on the website. Send us a letter of intent with why you think this program is a good fit for you. What is your background and how does it relate to the program? One-page summary would be good for this. Your updated resume, a list of 3 references, academic, it could be, church-related. It could be professional from work references. As long as you give us 3, we will be contacting them and sending them the reference form to fill out. And most importantly, make sure you explain why you're interested and why, and that your level of enthusiasm is evident in both the letter of intent application form as well as the online interview that you will be called for once you complete the rest of the application requirements. So please keep in mind that internships are only available to students that participate in the practicum. You must take the practicum if you are interested in taking the fieldwork extension. So I hope I was clear in explaining the 3 components of the practicum and how these continue to be applied in the internships. Hopefully I also gave you an idea of some of the projects that the volunteers did this past summer and will continue to work on in some way in the summer 2016. We are currently working on schedules, on communities, the type of interventions, activities that we will be doing specifically, and we'll be giving you updates along the way. So please apply as soon as possible, get in that paperwork, and feel free to email us with any questions that you might have, and we'll get back to you as soon as possible. Email us to volunteer.coordinator@amoshealth.org, and you can also visit our website at www.amoshealth.org. Thank you so much for your time, and I hope this was a helpful video, and we hope that you get in touch with us soon. Thanks. Bye-bye.